Hi everyone, welcome to your first short lecture for Pathophysiology 2. In today's lecture, I'm going to be talking about clinical terminology that will be brought up at various times throughout this course. And so it is expected that throughout this course you will have a good understanding of common medical terminology. Okay, so I don't want to scare you right off the bat in thinking that you're always going to have to write as much as you do in today's short lecture. So be prepared to do a little bit of typing today. What I'm going to do is present a variety of terms on the screen in front of you, and I'm going to go through each one and explain what they mean. If you miss a definition, of course you can easily rewind it, but many of these definitions you could easily find online as well. Okay, so again, normally you won't have this much writing, but with the list of terms that you can see on the screen, I'm going to define each one starting with the first one. Starting with the term idiopathic. Idiopathic means that there is no identifiable cause for something. And an example would be primary hypertension, so high blood pressure that can't be explained by anything else. Sometimes when you don't know the cause, you would expect that it would make potentially treatment more difficult because you don't know what you're correcting for. So again, an idiopathic condition or disease is one that has no identifiable cause. Next up is a risk factor. A risk factor is the increased probability that a disease will occur, but it does not cause the disease. So a risk factor is not the cause of a disease, but if one is present, it increases the probability that a disease will occur. So for example, your age. Age is not in itself a cause of certain conditions, such as osteoporosis, but it is a risk factor. The older you get, the more likely you are, especially as a female, to develop osteoporosis compared to somebody that's younger. So some other risk factors could be heredity, gender, race, environment, and lifestyle. Those are all potentially risk factors for the development of certain conditions. Precipitating factor. A precipitating factor is a condition or event that causes or triggers a pathological event or disorder to occur. Okay, so a condition or event that causes or triggers a pathologic event or disorder to occur. So for example, an allergen can cause an asthmatic flare-up. The allergen is the precipitating factor that causes or triggers the event, which is asthma. Etiology. Etiology, anytime you see ology, it's referring to the study of something. So etiology is the study of the cause of disease. So for example, is the cause of a particular disease infection? Is it heredity? Is it a malignancy? I'm just giving you a bunch of examples. Is it trauma? Etiology, again, is the study of the cause of a disease. And if we know the cause and we avoid what's causing it, we might be able to avoid the disease. And we'll see a lot of that throughout this term. Iatrogenic. A lot of students on tests, because these terms will be tested, will mix up iatrogenic and idiopathic. So just keep that in mind because I've seen that trend in the past. Iatrogenic refers to the result of a medical treatment. Okay, so some condition occurs because of a medical treatment, something that maybe wouldn't have happened otherwise. So an example would be, let's say somebody has strep throat and they're given a high dose antibiotic, let's say, to correct for it and kill off the bacteria. Then, because of the antibiotics in their system, their kidneys, for whatever, can't handle it, and the person goes into kidney failure. Unlikely, but it's still a possible scenario, especially in certain circumstances. So again, iatrogenic means that an iatrogenic condition is one that is the result of a medical treatment. And the example I gave you was kidney failure due to antibiotics. Another example, and I know somebody that was personally affected by this, she developed type 1 diabetes, and the cause was iatrogenic. And you might be thinking, well, what exactly happened? Well, I can tell you exactly what happened. So this particular person was suffering as a late age teenager with a lot of abdominal pain, digestive pain, your typical symptoms of irritable bowel syndrome. She didn't want to deal with it anymore, and I can tell you right now, her diet was absolutely the cause of the irritable bowel, but sometimes people don't want to blame their lifestyle choices, so she went to seek assessment. She saw a doctor who said, okay, you've got Crohn's disease, and didn't do any imaging or any tests to make this decision, but told her, I do suspect you have Crohn's disease. And because, and we'll learn this throughout the term, because Crohn's disease is an inflammatory bowel disease, you need to control the inflammation to control the person's symptoms. And you don't need to know all the details of what I'm explaining. I'm just trying to give you a real life personal example. So one of the medications that you may already be aware of that helps a lot with inflammation are steroids, in particular prednisone. So she was put on high dose prednisone to control her so-called Crohn's for many, many months. Many, many months later, I noticed that she was drinking a lot of fluid, going to the bathroom to urinate a lot. And I half jokingly said, you've got some symptoms of diabetes. Well, turns out, not only did she didn't have Crohn's disease, which means that taking high dose prednisone, the prednisone goes in the body and it's like, well, I don't know what else to do. The bowel's not inflamed, so I can't treat that. And it chose her pancreas to destroy many of the cells, in particular the insulin producing cells of her pancreas. So she ended up with an iatrogenic condition. Again, that means it's a result of medical treatment. Had she not been treated for her suspected Crohn's, she would not have developed type 1 diabetes. So it's important in cases like that, maybe for second opinions, but what you'll learn throughout your education and if you get into anything medical is that sometimes people just want an answer for the pain that they're in, something to justify why they're in pain, and so they will settle on whatever they're told and not even worry about additional opinions, especially if it seems to explain why they're hurting. So now this person has lifelong dependence on insulin. Okay, so very unfortunate situation, but real life example. So that's iatrogenic. Nosocomial, our next term. Nosocomial is a condition that would be acquired as a consequence of being in a hospital environment. So if somebody is not in a hospital environment, then they wouldn't develop the particular condition we're talking about. Nosocomial, again, is a nosocomial condition is one that is acquired as a result of being in a hospital environment. So an example is if you have someone that has cancer and they have to travel to the hospital to have chemotherapy sessions done, and then they end up contracting an infection from the hospital, that would be considered a nosocomial condition or a nosocomial infection. Okay, again, acquired as a consequence of being in a hospital or hospital-like environment. Signs versus symptoms. These terms are used interchangeably all the time, and they are very different words. And so from a clinical perspective, it's important to understand the difference. And then hopefully going forward, you use the correct terms when you're describing something about yourself or somebody else. So signs are observable. They're measurable changes that occur. Okay, observable, measurable, changes. So for example, blood pressure. You can take somebody's blood pressure, and if it's high, that's a sign that they might have hypertension. It's observable. I can measure it. I can see it in front of me. If I suspect somebody has a fever and I take their temperature and it's high, that is a sign that something's going on in their body. If somebody tells me that their arm hurts and I look at their arm and I see that it's all red and I see redness that tells me there's some sort of inflammation going on, that's a sign. Okay, I'm just giving you a bunch of examples to help you understand. And then another example would be if I took somebody's blood and I sent it to the lab and looked at their report and it showed that they had a higher than normal white blood cell count, for example. That's a sign. Symptoms, however, are subjective, whereas signs that we just talked about, you can say that these are more objective. Symptoms are subjective, and I'll talk about the difference between those in a minute. So add to your notes that signs are objective and symptoms are subjective. So symptoms are these subjective experiences that are going to be reported by the person that's experiencing the disease or condition. So for example, somebody says they have pain. Well, I can't see necessarily that they have pain, but they're telling me that they have pain. They're telling me that their abdominal area hurts. If somebody tells me they're nauseous, I have to take their word for it. Unless I see them throwing up, of course, that would be a sign. I can physically see them vomiting. But if they tell me that they feel nauseous, that's a symptom. If somebody tells me they have some shortness of breath, unless I can see that there's a change in their breathing pattern, it's just subjective. So they're almost like their personal opinion of how they're feeling. So objective versus subjective, you can think of it as objective, relating that, of course, to signs, but the term objective, we're referring to something that is, say, measurable. Whereas something that's subjective is really the person's perspective, their opinion on maybe how they're feeling. Okay, we're getting there. So diagnosis, the definition of diagnosis, just speaking rather generally, is the naming or identification of a disease. Okay, so you're identifying or naming the particular problem that a person has. And then your treatment would be based on the diagnosis. And there's another similar term that has the word differential in front of it. And I'd actually, even though it's not listed here, I'd like you to make note of this because it's important. So we have diagnosis, which again I said is the naming or the identification of a disease or condition. But a differential diagnosis is, and probably best for me to start off with an example, if I diagnose somebody with something, but I'm also thinking, well, it could be this or it could be that. And they're kind of in the back of my head. I feel pretty certain with my diagnosis, but there's a couple other things I want to keep in mind, just in case the person's presentation changes or whatever else. So that's called a differential diagnosis. And that's really important to have because it's, in a lot of cases, especially right off the bat, no matter what field you're practicing in, if that's what you end up doing, whenever you diagnose someone, you can't always be certain that that's what they have. You can be certain enough to diagnose them with it, but you always need to be open-minded and keep in mind that there could be something else going on. So having a couple of items on as a differential diagnosis are there and reminders that, okay, I also think it might be this, but we'll monitor the patient. Okay, again, that's differential diagnosis. Prognosis. Prognosis is the expected outcome of a disease. So this is how you anticipate, and this should be based on research, but how you anticipate the patient will progress. Do they have, sometimes it'll be rated as a good prognosis or a poor prognosis or an excellent prognosis. Sometimes prognosis is also tied in with a timeline, especially when it comes to cancer. So somebody might be given, 5 years, for example, of survival. Acute versus chronic. Acute is the sudden appearance of signs and or symptoms that typically last only a short period of time, okay? In the best case scenario, when somebody has an acute state, an acute condition or disease, again, where there's a sudden appearance of signs and symptoms, usually it will last a short time and then they'll get better. But in other cases, people don't get better. And if they don't get better, it can become, over time, a chronic state, disease, or condition. So then a chronic disease, it typically develops more slowly over time, or as I already mentioned, you can have someone that's in an acute state that just over time, many months go by, they don't get better, and then they fit into the chronic category. So a chronic disease typically will develop more slowly over time, but the signs and symptoms last for a long time, and that's what's key for that, and perhaps a lifetime. Some people live with chronic disease for a lifetime. And what's so sad about that is in so many cases it is preventable, but that will come up in many of our sections throughout this course. Chronic diseases can have periods of remission and exacerbation. So remission are periods where the symptoms disappear or they diminish significantly. Okay, symptoms disappear or diminish significantly for a period of time. Exacerbations are periods where the symptoms become worse or more severe. So it can kind of go back and forth on a spectrum of not really having any symptoms to having more severe symptoms. And a great example of a chronic condition is multiple sclerosis that has periods of remission where the patient's like, I don't have any signs or symptoms at the moment, and exacerbation where they're at their worst state. And then of course you can fall kind of in between that as well. And finally, we have clinical manifestation. Clinical manifestations are just your signs and your symptoms, or really the evidence that a disease or condition exists. Okay, again, the signs, the symptoms, or evidence that a disease or condition exists. So for example, and we'll see this throughout the course, there'll be a time where instead of me saying, here are the signs and symptoms of this condition, I might say the clinical manifestations of this condition are as follows. And that's kind of we could say it's like a umbrella term that encompasses all of your subjective and your objective signs and symptoms. And this won't take us long to go through, and this should certainly be recall from anatomy. So I'll go through this part really quickly, but you can look it up on your own if you're not sure. These terms here are more used, I would say, clinically. Ology I already described as being referring to the study of something or a field of study. So we'll see ology quite a bit. When you see osis, you'll see it, and I should actually clarify one other thing first, is you'll see that a lot of words will have either a prefix or a suffix to it when we're looking at many Latin and Greek words that are used as part of medical terms. And the prefix is just a word or letter that comes before the bulk of the word, and then the suffix is what's added to the end. So ology is a suffix, osis is a suffix, itis. So ology is the study of, when it's added to the end of a word, a study of whatever word is prior to it. So it refers to field of study. Osis is a suffix that you'll see to denote a condition or state. So scoliosis, osteoporosis. Osis refers again to a condition or state. Itis refers to inflammation. So an example, gingivitis, inflammation of the gums. Itis is inflammation. Meningitis, inflammation of the meninges. So anytime you see itis, it is fair to assume that there are some inflammatory markers that are present that would indicate that the area or areas are inflamed. You'll also hear intra and inter. Those are oftentimes used interchangeably, but they mean very different things. So the example I'm going to give you, I'll define it first. So intra would mean within, and inter is between. And the best way to explain that to you, I think, is the term intracellular versus intercellular. It will attach that to the word fluid. So intracellular fluid is fluid within the cell. Intercellular fluid is fluid in between cells. Very different meanings. The fluid inside the cells and the fluid outside the cells. It's very different. The term dis, when you see this as a prefix before a word, indicates that something is abnormal. And we'll see this actually in our first lecture. So dis means abnormal, and the term you'll hear in our upcoming lecture is dysplasia. Dys means abnormal. There's another term, dysmenorrhea, which refers to an abnormal menstrual cycle. So these are important to know for the short and long term, these words here, as well as the terminology here, if you have any intent of getting into anything possibly clinical. These words will come up again and again. So having this as just part of your normal language, you will be happy. So finally, just a reminder, superior versus inferior, we have above, below, medial versus lateral, closer to your midline versus further away. This should be a review, so I'm just going through it quickly, but look it up in your anatomy textbook or online if you need a reminder. Proximal is closer to, let's say, a joint or area in the body. Distal is further away. Anterior or ventral means toward the front. Posterior, dorsal is towards the back. Bilateral is a term that will be used as well clinically because if somebody has, let's say, pain in their hand, you'd want to know, is that pain bilateral? Do they have it in both hands? Or is it only on one side, which is ipsilateral? Ipsilateral can also be used to indicate structures that are on the same side. So let's say my left arm and my left leg are ipsilateral structures, whereas my left leg and my right arm are contralateral, so opposite sides, contralateral structures to one another. So it's all relative, of course. And then finally, symmetrical versus asymmetrical. Symmetrical, think of symmetry. It means that things are the same. So let's say I have pain in both of my arms. The question is it the same? Is it symmetrical? Am I experiencing it? It's bilateral, but am I experiencing it the same on both sides? Or is it asymmetrical where I have a little bit of pain on the right side and significantly more on the other? Okay, so that is the end of our short lecture on clinical terminology to start off the term. I hope you enjoyed the lecture and feel free to let me know if you have any additional questions. But thank you so much for listening and I hope you have a great day. Bye for now.